I'm Eric Schoenberg, Editor-in-Chief.
And I'm Jill Schlesinger, Editor-at-Large.
In today's reality check, as the President signs healthcare reform into law, it's time to discuss who is really going to wind up footing the bill. All right, Jill, we're now committed to a $940 billion healthcare reform bill. All that's left is to figure out how we're going to pay for it. Where does it even start?
Well, I think the big chunk is something about like $500 billion in cuts to Medicare and Medicaid. So that's the lion's share of it. Now we have the other part, which is we get to spank the companies that we've always thought were the bad guys. Now, of course, if you work for those companies, ignore this part. But those would be, again, the device makers and the insurance companies. And there's going to be billions gained through that process. There's the little tax you have on individuals who don't get coverage, on businesses who don't provide coverage. Oh, and Eric, did I tell you about the tax increase?
Oh, no, there's a tax increase?
Yes, for you and your wealthy friends. That's anyone who makes $200,000 a year as an individual or more than $250,000 as a couple. Two ways the government's going to get some more money. One is an increase in your FICA withholding, about 0.9%. And then here's something that's wild. Another 3.8% tax on unearned income, interest and dividend income. What's interesting to me is how that might get expanded to other types of investors or other people who don't make 200 or 250. Do you think that's a possibility?
No, I think anything's a possibility. I think that a lot of those revenue numbers sound kind of fishy to me. For example, how much money are you going to raise from companies that don't provide the required insurance when the companies can easily avoid that tax by providing it or by sending people out into the exchanges? I am also curious too about what's the point of taxing capital? An extra 3.8% tax on dividends and interest makes municipal bonds very interesting, makes Roth IRAs very interesting, and any kind of tax-deferred account look a lot better.
You know, Eric, another thing that's sort of perplexing, and this whole thing is perplexing, is the idea of how they're taxing Cadillac plans. Now, this seems like a very smart idea. In other words, we're going to tax people who provide too much in health care, really change behavior, right? But because of the union power, that doesn't kick in until 2018. God knows what kind of lobbying is going to go on between now and then before those rules take effect. I'm worried that that's the one area where we really were going to be able to make some substantive changes about how consumers use their health insurance, and yet it gets watered down in the end.
No, that is interesting. And a 40% tax just means it's not a way of raising money, it's a way of stopping that kind of plan from happening. At the same time, by adding in all these requirements, these minimal insurance requirements, means that every plan becomes sort of a mini Cadillac plan. And so for a 20-year-old in good health, the opportunity to buy a high deductible, minimal coverage, catastrophic care policy just doesn't really exist anymore. The lack of choice is a bothersome thing to me.
And the last thing that I think that we should probably point out is that the bill as it was originally conceived is not something that's going to stop healthcare costs from exploding. That's sort of the shame of it. We've gone through this amazingly arduous process, and at the end of the day, have we done anything to really contain healthcare costs in the future? I'm not so sure, and I'm worried about that.
That is the absolute biggest question. I mean, the reason to do this is because it might be the first step down a long road of getting healthcare costs under control. And I would say that, to take the optimistic point of view, as I like to do in conversations with you, is that you can't really get healthcare costs under control until you have most people covered. You have the ability to have, as insurance works, to have the healthy subsidize the sick. That's the way health insurance works. That's possible now under this bill, and so that minimal condition is now met, and maybe now we can get serious about controlling healthcare costs, but we'll have to see. And that's your reality check. Thanks for watching.